the most important part, which I said, that the psychological aspect.
Yes.
People should be aware about their own bodies, and that's my first thing. Whenever I see a person, I want to make sure that you know about your body first. It's not a very sort of a transactional sort of a relation.
Absolutely.
I have a bond with each and every patient I meet.
Yeah.
Most of us have a tendency of sitting cross-legged sometimes. We are shifting our weights constantly. So long durations of sitting will cause that problem. You need to take care of your fueling. You need to take care of your recovery. You need to take care of what kind of warm-up drills and stuff that you're doing.
Hello everyone, welcome to RunPlayGo-Unfiltered, the podcast where sports meets soul. I'm your host Shivani Singh, a marathoner, sports media veteran and the founder of RunPlayGo. Today's guest is someone who bridges two worlds beautifully, athlete and expert. Dr. Paridhi Ojha is a former national level tennis player and now a leading sports physiotherapist, working with elite athletes across disciplines. From injury prevention to performance recovery, Paridhi's approach is science-backed, athlete-tested and deeply rooted in her own comeback story. We're going to talk about what runners and endurance athletes often get wrong, how to fix it and what it truly takes to train for the long run, not just the race day. Whether you're a beginner runner, a weekend warrior or chasing your next ultra, this episode is your masterclass on movement. Let's dive in. Welcome Paridhi to the RunPlayGo Masterclass on Sports Physiotherapy. It's an honor and a privilege to have you with us today here.
Thank you so much for inviting me. It's a pleasure to be here.
So Paridhi, it's a very special section for us, and I couldn't think of anybody better than you, because you've been an athlete yourself. You've been a national level tennis player. So from there to here, the journey of purpose, as I call it, and from court to the clinic. So Paridhi, you were a top level tennis player before you became a sports physio. Take us back, how did this transition come about?
So I started playing tennis at the age of 6. Before that I was doing skating recreationally here and there, just as an evening hobby. And from there I just picked up tennis in my school, and it was mandatory for us to play one sport in the morning at least 4 times a week. So that came from school, wherein my skating stopped and they were like, now you need to choose another sport. So I'm like, okay, let's try tennis. So I went to the tennis court, tried, and it just felt very good. And just through and through, some PT classes, and 2-3 weeks into it, the tennis coach called my mom that she needs to join the evening academy. So I was like, okay, fine, let's do that. And when I joined the academy, it was a very new game for me. And I did not dream of actually playing it professionally at that point in time. And I just enjoyed it. So I played it all through and through till the age of 12, 13, and then I started playing tournaments. So when I started playing tournaments, I felt that, okay, this is something which I think I can grow professionally in. So as any athlete, you dream of becoming a best player of, your school, and then the CBSC, you win that, you go to the next stage, you want to get into the Delhi state, and then you go get into the Indian team. So my journey till the Delhi state was pretty smooth, and I felt that, okay, there were some small niggles which happened here and there. But Delhi state, when I was selected for the first time, I did not win a medal that year. I just was selected and I participated. It was a good experience, very good as you learn a lot of discipline, and you see how other players are performing and what the opponents are doing. So just like learning the strategies and just getting through that feel of it as a new sport. After that, the next year, I won a gold medal, which was a very, very big thing for me. Correct. Which I just felt like, okay, oh my God, like this is a big achievement. And my school was very, very supportive. I did not attend a classical school for about 2 years.
Wow.
And I was only playing tennis professionally.
Wow.
So they were all in for me that, okay, go play, do everything possible, and we are there to support you. And in those times we did not have WhatsApp or any emails. It used to be that my class teacher used to just photocopy a notebook and then give it to me, like, go study because you cannot be missing out that. So that was the balance which my school made it for me. And till the time I reached a point where I turned 17 and I played 38 tournaments in 1 year.
Wow.
Which was, I think, the peak of my career. And that was the year where I wanted to enter the Indian team. That's the year when I injured myself.
Wow.
And that's when I realized that, okay, thank God I was studying also. Otherwise,
Yes.
I could not do anything else.
Yes.
And for someone playing tennis, like, 6 to 7 hours in a day, and then telling someone that, okay, you can't play anymore, like, just shut down, just stop. It was like really shattering.
Correct.
And then the only question which I typically used to ask every doctor, when can I get back? Like, when do I play back?
Yes.
I need to do this because I cannot sleep now.
Correct.
So that was something which was the turning point, wherein I realized that every doctor just suggested, okay, go ahead for a surgery, probably do an injection, do some medication. Let's try and see what works for you, what doesn't work for you, and we'll figure it out later.
Yes.
So from there, when I actually underwent that, process of running after all the doctors and seeing that, okay, what will work best for me, I just realized that, okay, probably this is it. Wherein I had the choice, because I was in 10th standard that time, and I had the choice of choosing my, science for my 11th, 12th, or commerce or humanities. So I just decided that, okay, let me explore what it is.
Yes.
So while I was exploring, I explored the field of sports in terms of professional degree, wherein one option was to do a sports management or a sports physiotherapy. I could not do anything else beyond sports. So I just cannot do a 9 to 5. I cannot sit in front of the computers. So that's when I just realized, and I think just happened at the right timing for me, that I was in 10th standard and I realized that, okay, this can happen now, as compared to all the athletes I see who are just completely only into sports. And after, every athlete has a shelf life. So after a certain point, you realize that, okay, now what?
Now what?
If you grow into the sport, you excel, your name is there. But if you don't get that name and fame,
what's the
alternate
other
path? Yes.
What's the alternate path for you?
So that's something which only if you have something already ready for you
Correct.
as a family business, you're getting into it.
Correct.
If not, then you're something
Yes,
where
yes.
you're figuring out, okay, what now?
Absolutely.
So it just happened at a good timing. It took
You were only 17 at that time.
I was
when all
17.
of this was
Yes.
going on.
And it was all because of mom, who kind of like strategized things for me that, okay, now this is there, now this is there. So what do you want to choose?
Yeah.
And those 8 months of rehab, which were the most painful months for me, because I could not play, I could not do anything, and the only thing I could do is to attend school study.
Yes.
And I was like, okay, why? Like, this was not a pattern that I actually dreamed of doing.
That wasn't the path.
Yeah. And that just happened to me at that age. And from there, I just realized, I went to a few physios that time. Nobody really understood the psychological part more than just the sport part. It was more like, okay, don't play, it's okay. Like, relax. Like, we'll play after 4 months, we'll play after 6 months. Why do you want to rush to go at sports?
Correct.
So that was something which was like more traumatic, I would say.
Yeah.
And that hit me hard as compared to that, okay, there is an injury, it'll get okay, that's fine. Like, body will heal. But of course, at that point in time, I did not understand about so much of biomechanics of my body.
Yes.
As compared to, now that I look back, is that, okay, there were things which could have happened. So that's something where I feel that that led me to choosing this path of that, okay, I need to do med school, get my master's into sports. So some field of sports. So it could not be sports management. So that's how I chose in sports physiotherapy. And I did that. And then from there, now here I am.
From there to now, as we said, from the court to the
clinic.
To the clinic. Absolutely.
Yeah.
So Paridhi, your own journey, your own injury at 17, how has that shaped your approach today towards injury prevention and rehab for others?
So the most important part, which I said, that the psychological aspect.
Yes.
It's not just the symptomatic release that, okay, you have an injury, you mask that pain, you deal with that. But it's the root cause behind it, figuring it out as a more holistic approach.
Correct.
As compared to just looking at an injury or a person as that, okay, this person is there, now there's an injury, we'll fix that, we'll mask that, and go ahead and play. So it was always about a quick fix in those times, and now it's not. So now I feel that no, I need to know the person. I need to know how and what their psychological state is, and what they want to do. What are the strategies that I can help them with.
Understand the journey.
Yes.
An athlete's journey.
Yes.
And then, absolutely.
So that's something which, because I have felt that, to now being on the other side of the table and then feeling that okay, I want to help them to be able to make sure that they excel in this sports.
And I think, in my personal experience with you, when I came to you last year when I was undergoing a very long period of an injury which we were not able to even establish the cause of, because I had gone through all the relevant tests and I had done a lot of rehab at my end and all of that. And I think for me the biggest differentiator after coming to you was precisely what you're talking about. Your engagement and investment in my journey was something which probably also made a huge difference in my wanting to try out a lot of things which I hadn't done before that.
Yeah.
And that constant nudging and checkups every third day. Did you the follow-ups? Did you do the exercise that I asked you to? All of that made a humongous difference. So I so appreciate what you're saying, and being an athlete, I think that's the lens that you bring to this, and that makes the biggest difference.
I think it's also about, because you felt it and then you try to help the person.
Correct.
So it's a very different feel altogether. The approach while working is very different as compared to just looking at a person that, okay, this is not a very, sort of a transactional sort of a relation.
Absolutely.
I have a bond with each and every patient I meet.
Yeah. Absolutely.
So,
So now talking about endurance from a physio's lens, because I think that's a very important way of looking at it. So how do you think endurance athletes are different from others in terms of their physio needs?
So endurance sports, as we all know that, it's requiring more amount of time duration while you're training, and you use a different set of muscles. Which is the slow twitch fibers as compared to the fast twitch fibers. So, for example, if you are a sprinter or you are a golfer, you're going to use a different set of muscles as compared to an endurance sport. Well, you'll use a slow twitch fiber for a longer duration. So, as when we talk about the physio needs, we feel that, I personally feel that while you're working with an endurance athlete, there's a lot of active wear and tear happening on an everyday basis.
Correct.
So you need to take care of your fueling, you need to take care of your recovery, you need to take care of what kind of, the warm-up drills and stuff that you're doing, because sometimes we feel that just the static stretches will help. But that's not the right case.
Correct.
It is needed to be that you need to do dynamic stretches so that you don't injure yourself. So that's something which I feel is a major difference in terms of that you need to work smart as compared to a short distance or a golfer who just requires a certain different set of muscles. So on a regular basis, you need to take care of recovery. You need to make sure that you're fueling right. You need to make sure that you're foam rolling, doing your warm-ups. Everything is to be on point.
Exactly. So some of the common running related mistakes and invisible injuries, and I think I've experienced this myself, because we don't really come to a physio till the time I know that this is something that I know that I'm in trouble, and it might actually be a confirmed injury. So there are these small niggles and pains, and if I may say so, athletes also take pride in that. That I'm a runner, something is going to happen, so there is some wear and tear on everyday basis. So let's not get too perturbed about that. It's only when I know that tomorrow morning I'll not be able to run is when we come. So those are the invisible silent injuries which a lot of us encounter from time to time. So what are some of the common mistakes that we make in
the first one, I think the most common one, is the shin splints, because when you feel that there's a little bit of a calf tightness, we just kind of ignore it. We feel that, okay, I'll just stretch it out, or probably I'll just foam roll it, and I'll try to manage it.
Absolutely.
Up until it becomes an active shin pain. Because there are 3 stages of any injury, wherein the first stage is when there was a slight niggle, because body will always give you a sign. Body is made very beautifully that you will have a sign that, okay, there's something wrong, but it's just that we tend to ignore it initially. And shin splints is something wherein you get the sign from the body, but you tend to ignore it up until it reaches to a point where you're like, okay, now it's an active pain. And then now what do I do about it? And most of the cases in shin splints, it also leads up to a stress fracture, wherein you just feel that, okay, it only happens when I run. Like otherwise I'm okay.
Yes.
I don't feel anything throughout the day. So once the body is warmed up, I feel okay. So that is something which actually leads up to an internal damage which is happening, which your body is trying to alarm you when you're doing something.
Correct.
But we tend to ignore it. The other problem mostly with the endurance sports as runners is that it's something called as a dead butt syndrome, which throughout the day most of us are sitting.
Yes.
You know, you have your MNC jobs, you're working, you're sitting through and through the day.
Correct.
Now the glute muscle gets overworked and it's so constricted while you're sitting for longer durations that you cannot activate it when you're running.
Absolutely.
So that is something we don't realize that, okay, what exactly is happening with my body, but that can actually lead up to an injury. So this is another very common invisible injury which we don't realize it, and it leads up to a bigger problem later.
Absolutely. So, and the second part is actually even more relevant because most of the athletes are beyond the morning 2 hours of run. We are regular working people,
sitting,
right?
Yes,
we are sitting at our work desk or anything else that we are doing most of the time.
Yes.
So just digging a little deeper into that, the first and the second part both. So how and when to know that now this is an area of concern and we should take the next step of actually reaching out?
So first step is that when the body gives you a sign, if it happens for a day, it's okay. Like you have had a break and you've gotten back to workouts, you feel a day or two of soreness, that's okay. It should settle down. But if at all it is lasting more than a day and you feel that no, it has happened today, it's happened again tomorrow, and then if it happens another day, that means that the body is giving you a sign that stop. But we kind of ignore it that time.
Right.
So that's something which is the first sign. Or if there's any sort of an inflammation, swelling, if you see any pain, tenderness on touching or feeling it, as sometimes it also happens that the running form changes and you don't realize it.
Yes, absolutely.
So that's another thing which I see that, okay,
especially
my
with the
form,
glutes.
Yes, because one side, like most of us have a tendency of sitting cross-legged sometimes. We are shifting our weights constantly. So long durations of sitting will cause that problem. And as females, you know, it's a convent school thing that, okay, you need to sit a certain way. So that's something which is inbuilt as a habit for over the years. And we cannot change that within a day. So those things have actually caused the imbalances in our body, and that can lead up to the injuries. So that's something which I feel that people should be aware about their own bodies. And that's my first thing whenever I see a person. I want to make sure that you know about your body first.
Correct.
Because my role is to figure it out, tell you that this is the root cause, but you are living with your body.
Yes.
I can only tell you, I can only guide you that, okay, these are the things that you need to make sure. And my role is 30% as compared to your role is 70% to make sure that you're following those things.
Absolutely.
So that's something which I feel that people should be aware about their bodies, how they're using it. Sometimes I ask people, how do you sit? And then they'll kind of like figure it out. Oh yeah, I do tend to sit like this. Or, you know, I have a certain habit of doing such things, which we don't realize it on our regular basis. So we need to be mindful about our bodies, that how we're using it. Sometimes we do tend to abuse it either.
Absolutely. You bang on, and I remember the last session when I came to you, we had the same conversation about the sitting posture, and that could actually be creating the little niggle that I was having around that. So Paridhi, tell me, what are some of these screening and annual assessments that you may recommend to every runner to have on a regular basis, annually, ideally?
So there's something called as a pre-participation examination, PPE, which we do for professional athletes, which is to just create a baseline that, you know, how you need to basically your medical tests, your blood work, your just regular movement screening. There's a detailed assessment that I do. So those things are some things which I recommend that is to be done. For runners specifically, because you have a tendency of using your body a certain way that you need the slow twitch fibers, you need to undergo a detailed assessment called as a movement assessment technique, which is a MAT testing, wherein I test how your muscles are working, how they are, you know, what's the strength like, what's the stability, how is your mobility. So all of those areas have to be assessed.
Correct.
It also is a part of a functional movement assessment, which comprises of things like doing a deep squat, which a lot of people, after a certain age in childhood, you stop doing that deep squat.
Correct.
So you are not able to do that. But that is a functional pattern of the body which needs to be screened.
Yeah.
So that's something which I recommend that at least 2 to 3 times in a year, depending on your training capacity and what you're targeting, you should undergo that so that you know first, in order to get a baseline, that where do I start with and how much can I push. Also checking on that, okay, if there is an improvement after 4 months or not.
Yes.
So you know that, and then the remaining parts you can work upon.
Correct.
So that's something which I recommend, to do a detailed assessment, which we do at the clinic, and I feel that really helps to create a better athlete.
Yes, absolutely. And also, it will also help you in catching early if there is some restriction which is cropping up.
Yeah.
So no, absolutely. And Paridhi, you also work with elite athletes.
Yes.
So what are some of the things in their training, and they undergo absolutely intense screenings, training, rehab and all of that. So what are some of the things that they do on a regular basis, but amateurs don't, but they should?
So when we talk about elite athletes, it's also to do with that their major focus is only on the sport.
Right.
Sport recovery, because they're dependent on that and they have to perform their best.
Yes.
So they really take care of their fueling, they take care of the sleep, the basics, all of these things are taken care. As compared to an amateur, you have a daily routine which is probably apart from the sport, also a certain set of responsibilities, you have to do certain things. So that is something which we think that the body will recover. We take our bodies for granted a lot, which we should not. And that is something which I feel that people should really focus on the recovery. So fueling and recovery is the major component, which plays a huge role in that. And that's something which I would recommend everyone to take care of, because otherwise, you're running in less sleep and you're like, okay, I need to juggle around with my work also, my family also, my, other things that you need to do. So that's something which I feel that people should take care of.
Yeah. And all this juggling actually is what creates a lot of pressure points all across in all areas.
Yes, yeah. And also
because impacts recovery in a big way.
Absolutely.
Yeah.
Because when you're looking at a professional athlete, they really take care of each and everything to the point. And up until, when we reach to a point where you are an amateur person, where you're like, okay, I can deal with this. My body will recover. It will not.
Yes.
You need to really take care of it.
Yes.
So listen to your body.
Correct.
Like that's the most important thing.
Correct. No, and as I'm, as an athlete, I'm realizing myself as well, the recovery is actually a part of the real workout.
Yes.
It's not something optional. It's not something which is, that we do when we get time or we don't get time. It's an active part of the workout itself. So if you have a 5 days or 6 days training plan, one of the recovery days is actually a part of the plan.
Yes.
You can't really...
You should not ignore it.
Yes, absolutely.
Yeah.
So now switching to another very intense topic of interest that most of the athletes have is a mix of gait, gear and groundwork, as I'm clubbing all of them. And let's talk about gait analysis. There's a lot of conversation about it all the time. And so there are two parts to it. A, is it necessary? And how does it benefit the athlete? Because we see a lot of resource centers who do this, and there is this conversation that it can really help in terms of your performance. But then there is also a contra view that there is a natural form that you have, and do you really need to do a lot of modification to that to be able to perform at your best? So it's a little bit of a confusing area always. So let's dig into that.
So first talking about gait analysis. So gait analysis does give us a detailed assessment of that, okay, how is my body functioning while I'm running. Running is a unilateral sport, so it does not demand your body to be on both feet all the time on the ground. So you're running on one foot and then the other and then the other. So while we're doing an assessment in a very controlled environment, it's been about 9 years that I've been working. Like I feel that I have evolved over those years through and through learning how that gait assessment works. Because initially what we used to do is ask the person, we used to mark some points on the body whole over, and ask the person to just walk first and then do a run for about 10 meters, view it from the back angle, view it from front, view from the sides. So all of those 3 angles are noticed. But is that the natural form that you would be while when you're out on the roads?
Correct.
Because when you're doing a gait assessment, like on the mat or otherwise on even the treadmill, you're asking the person to do their best, but you cannot mimic the same thing what is happening on the roads. And when we only talk about the gait analysis, it tells us about the angles that okay, my hip is dropping, my knee is bending, my ankle is dropping. So all the areas are just screened as a whole, as a complex of that, okay, this is what it looks like. But that can also vary when you're out on the roads, because when you're out on the road, it will be very different in terms of how the environment works for you, the clothing that you're wearing, the kind of things that you're carrying. Sometimes I see people carrying their bottles on one hand, and that will alter while you're on the treadmill. So those things are very altered. Another part of it which I feel now is that you don't get the detailed assessment of how is my mobility of each and every joint, how is my stability, and how is my strength. Because while you're doing just a gait assessment, you only see the person moving and you can only measure the angles. But while you're doing a detailed assessment to identify how the strength is, you can know much more details about it and work towards it. Because running form, I feel, can be changed with just the muscle mechanics. You don't need to tell a person that okay, your running form is incorrect and now you need to just put a heel strike or run on the toes. No. Because that is something which is natural of your body. I run a certain way, you run a certain way. Every person can run. So running is a natural form which can be attained by every individual, and you can have a natural form by your own. So it cannot be pushed or pressed upon that okay, you need to change this and you need to only run on your heels or you only run on your toes. So that's something which is natural inbuilt in your body. Now while I'm trying to do that on a treadmill, it may not be the best form. So I would emphasize that if people can do probably a video, which could be a just general video, which you're just running on the road 50 meters back and forth and then view it from the side. That is good enough to know how your running form looks like. And then going ahead and seeking an expert who can help you to identify how is the stability, mobility and your strength. Because that will tell me more details about what I need to change. There are times I have seen that people have a very different pattern of running because of their old injuries. Which while you're doing the gait assessment, you know that okay, this injury happened. But how did that alter their form? That cannot be get through only the running assessment. So that's something which I feel that people need to know that. Also things like people don't know how important is toe strengthening or foot strengthening, because that's something where your entire body weight is dependent on. So you need to make sure that that is happening, as compared to only looking at a person and saying that okay, maybe the foot is landing a certain way, you are landing on the outer side, you're landing on the inner side, and okay, just looking at the shoe soles and saying that okay, this is getting worn out more and that's getting worn out. So that's something which I feel that people should get a detailed assessment of the strength. That is how you will be able to know that how my body is functioning.
You are absolutely right about that, Paridhi, because I've gone through this myself. And in the initial assessment, which was a few years back, it came out that I was not landing on my midfoot like I should have. And then the recommended drills and the push was to move it forward a bit. And as I did that, I started getting slight pain in my shins. Because there was that forward movement, and suddenly out of the blue I started trying changing my running form to match with the goal which was given to me. And then that pain kept on going up, and I understood that something is not right about this. And then while the consciousness came in that maybe you can probably at your own end stay conscious and try and run a little forward, but that's about it. Anything beyond that, if I were to change, I would have gone into a zone which probably would have gone into an injury.
Maybe,
So you're absolutely right that this very unidirectional way of doing the gait analysis may not be giving us all the variables that are needed to come to the final conclusion.
Absolutely.
So thank you so much, Paridhi. It's been such a pleasure speaking to you.
Thank you
And
so much.
all the very best in helping and guiding and nurturing all the athletes like me. And
I
all
hope
of us around.
don't get injured. prevent
Yes.
prevent injuries.
Absolutely.
Yeah.
So
Thank you.
Thanks so
Thank
much.
you so much. Thank you.